Okay, let's go ahead and start. Good afternoon, everyone, and welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. For over 2 decades, eLotus has been your trusted source for premium CEU content for acupuncturists. We offer the largest selection of online CEU courses with over 3,000 CE hours. If you are new to eLotus, we invite you to sign up for a new account. All new account holders will receive a free 1 CEU course of your choice. And did you know that we have a TCM resources page for COVID-19? You can find it at eLotus.org, and I'll go ahead and take you there so you will know how to find it. So as the website's loading, here we go. So let me move this over here. Okay, under continuing education, you'll find free stuff. And under free stuff, you'll see COVID-19 resources. You can go ahead and click on that to be taken to the COVID-19 resource page. And here you'll find past webinars of Dr. John Chen and a COVID-19 formulas charts, articles, and some of them are written in different languages too. We have interviews and official recommendation handbooks and much, much more information. So you can go ahead and take a look at this later. And again, it's under continuing education, free stuff, and then COVID-19 resources. And if you want more information about the Chinese herbs, check out Dr. Chen's herbal books. He has the single herbs book, which is Chinese medical herbology and pharmacology, as well as the formulas book, the Chinese herbal formulas and applications. You can go to AO1 Press to see some sample pages. So here's the single herbs book, the formulas book, and there's also an herbal formulas book for veterinarians written by Drs. Sine Bibi, Michael Slutsky, Dr. John Chen, and Tina Chen. So let's go into the single herbs book page, and you can see here that there are some sample monographs. And I'm going to choose Gantao as an example. So this is what it looks like exactly in the books, and it gives you the Chinese therapeutic actions. And unique to this book is chemical composition, pharmacological effects, clinical studies and research, and herb-drug interaction and toxicology. As you can see, the information for this one herb is very extensive. And to get a copy of a book, you can go to www.evherbs.com. And here in the search box, you can type in Dr. John Chen's name, just like that. And then the 3 books will pop up and you can get your copy there. Okay, so today's class is with Dr. John Chen, who is a recognized authority in both Western pharmacology and Chinese herbal medicine. And today's webinar is post-COVID syndrome and TCM treatment. For those of you who would like to get the handout, you can find it on the courses access page. And on this page also, Dr. Chen will be referencing Qigong videos, and the Qigong videos are on this page as well. So you can find it at eLotus.org. And just, you know what, just in case someone needs a visual for it, you can go under CEU courses, under 2021 schedule. And today's webinar is right here. And then sorry about that. I was not logged in. You do need to be logged in to access the notes and to see the videos. So if you are new, again, another reason to sign up. Okay. Okay, so you click access course here, and this will take you to the course access page where you will find the lecture notes and the videos that Dr. Chen he's going to reference. It's the Qigong videos by Kadipan. And if you guys have questions, please feel free to type them into the Zoom chat room and I'll be happy to respond there. So without further ado, let's go ahead and give a warm welcome to Dr. Chen and we can start the class.
Okay. Hello, everyone. So before I go ahead and start, just doing a quick audio and video check. So those of you who are watching this, please give a thumbs up. So Donna and Sam know that we are all good before I proceed with the material. So I'll wait just a second. How's it looking? Okay. Audio and video check. Audio and video check. So, okay. Looks like we're good to go. All right. So, welcome. Our topic today is going to be on post-COVID syndrome and TCM treatment. Okay. All right. Sorry about that. Okay, so like I said, our topic today is going to be post-COVID syndrome and TCM treatment. And I think the best way to get the most out of this class is to view it in its entirety. And what I mean by that is I have done a total of 4 classes, including this one, on COVID. And the first 3 were done last year, and obviously this is the last one of the 4. So in order to get a good overview of this topic, it's very helpful if you watch part 1, part 2, and part 3 before today's part 4. All right, and all 3 parts are available at eLotus.org, and they are also available on YouTube. All right, so you can watch it at either platform, and all the PowerPoint presentation slides are available. All right, so the focus obviously last year was on how to treat COVID. Okay, the first class was on the classic information of how TCM treats influenza and viral infections. And we focused on 2 of the main schools of thought. One is Sanghan Lun, discussion of the cold-induced disorder, and the other half is on Wen Bing Lun, which is discussion of the warm and hot disorders. So this is the classic way of approaching various infections. Obviously, coronavirus was brand new at the time. Okay, so a lot of new information was introduced specifically on what is the best way to look at it from a pattern differentiation perspective, what are the most effective formulas to use, and also what are some of the single herbs that are the most effective. So what happened is within a very short period of time, various protocols were established, both on a regional level, provincial levels, and also national level. So you have the protocols from the Wuhan Union Hospital, from the Hubei Provincial Hospital, and also the national guidelines. All right, so these are the things that we touched up on last year on how to treat coronavirus. And then the last part of what I did last year was to go one step further and look at the scientific research and clinical evidence. And in that class, we look at many formulas and single herbs and how they work on the molecular level to treat coronavirus, either by blocking the entrance of the virus into the cells, stopping the replication of the virus, or stopping the release of the virus into the circulation. All right, so many different herbs have many different compounds, and they all work differently. All right, so that is more on the pharmacological and molecular level of how Chinese herb work. So these are the 3 classes that I did last year, sometime between February, March, and April, to establish the foundation of how to treat coronavirus. So I think we have all, as an entire medical community, done a great job to help to know and also how to treat the patient to the best that we can. obviously, during that time, the main emphasis and the main focus is on how to treat this acute urgent condition. All right, and if you were to fast forward, we're about a year from that time. What we have now is we have a good understanding of how to treat COVID from both Western and Chinese medicine perspective. And at the same time, there's obviously a lot of vaccination that's available. So we are probably toward the tail end of this pandemic. But what happened is we are not quite at the end. And the reason obviously is because a lot of people have gotten over the infection. Okay, but it's not quite the end. This is a statistic from the Johns Hopkins University as of February 15 when I put this together. As you can see, there's over 100 million cases, over 2 million deaths, and the people that have recovered is in excess of 100 million. So what happened is most people are able to recover fine, but unfortunately there are some that suffer from severe COVID that were hospitalized, and when they are discharged, even though they are over the infection, they are not quite back to normal. Okay, so one of the main contrasts between Western medicine and Chinese medicine is that in Western medicine, when the infection is clear, when the body no longer has the bacteria or the virus, and the test result comes back negative, basically from Western medicine's perspective, these patients are done with the infection, they are sent home, and it's basically case closed. And in fact, you can tell from this medical journal published in German, basically the title says, is there a post-COVID syndrome? Basically the idea is they doubt, they wonder whether something like this actually exists. Because like I mentioned, they consider when an infection is treated that there's a cure and that the viral infection is not going to come back. But what happened is, despite what the medical community thinks, the patient community voiced a completely different scenario. Okay, this is from a YouTube video. Basically, all these patients who recover from COVID list out all the signs and symptoms they have, how many days they are post-COVID, and basically, as far as they are concerned, they are just not completely recovered. Okay, and they all show different signs and symptoms. So this is a chart that I think describes it very clearly. Okay, on your left-hand side of the chart, it lists some of the main signs and symptoms with acute COVID. And then on the right are the post-COVID-19 signs and symptoms. So as you can see, some of the most common post-COVID signs and symptoms include fatigue, dyspnea, joint pain, chest pain, cough, anosmia, Zika syndrome, and so on and so forth. All right, some of these may be mild, others may be quite debilitating. All right, so quite a few number of these patients who recover from COVID, in fact, have COVID-19, post-COVID-19. And the percentage vary quite a bit. The range that I have heard is between 10 to 80%. So basically that means there's really no consensus. All right, so we do have to take this seriously because some people may have mild signs and symptoms post-COVID. Others have quite severe and perhaps debilitating signs and symptoms. So this is an article that I think sums it up pretty well, that early rehab in post-acute COVID-19 patients have many different signs and symptoms, and that there's a need to establish a protocol and treatment. All right, so like I mentioned, some of these are relatively minimal, dyspnea and shortness of breath, but in some cases it can be severe disability. All right, so Western medicine at this point in time recognize there is post-COVID syndrome. They are not sure exactly how this happened. They are not sure exactly what are all the signs and symptoms. And they are also not sure what is the best way to go forward to treat these patients. So they are still gathering a lot of data. They are still deciding what's the best way to go forward. But nonetheless, they do recognize it. They are now post-COVID clinics that are aimed to help with the patient with the rehab. Okay, so most of the treatment at this case is going to be symptomatic, supportive, and also some type of physical therapy. All right, so that's going to continue to evolve as long as we keep our ears and eyes open. We'll find out what is the best way to go. All right, so now the question is, how does this happen? right? So initially what happened is the coronavirus mainly enter our bodies through the respiratory tract and also to some extent through the gastrointestinal tract, but mainly the lung. So generally speaking, as the coronavirus enters the lung, its first place of attack is the lung. It attaches to the ACE inhibitor, ACE receptor, enters the lung, cause a lot of local injuries and inflammations, and perhaps accumulation of fluid, fibrosis, and so on. So it causes a lot of actual damage to the lung, actual decrease in the function, and also the scarring. But what happened is the damage is not quite isolated only to the lung. And in fact, what happened is many other parts of the body also have ACE receptors. So the virus can travel throughout the body by attaching to the ACE receptors in various organs and systems, and thereby go to different parts of the body. What may also happen is during acute COVID, the body may suffer from cytokine storm or may have immune dysregulation. So what happened is the body may suffer from direct viral damage, or different organs may suffer from inflammation and also immune dysregulation. So as a result, lung is really not the only organ that suffers from damage, but rather many other organs also suffer damage as well, including your brain and the nervous system. So the patient may show a lot of neurological signs and symptoms, including the renal, the kidneys, the liver, hepatic, the gastrointestinal tract. The patient may also have thromboembolic events, clotting events, as well as cardiac issues, endocrine issues, and dermatological issues. All right, so even though COVID-19 starts out primarily as a lung illness, but what happens is if not treated well, the lung illness can then spread and many other organs can be affected. And this is definitely true both in acute cases and also in chronic cases. All right, so according to this article here, therapeutic options of TCM for organ injury associated with COVID-19 and the underlying mechanism. What it goes on to say is there are three main pathophysiologies of how COVID-19 and post-COVID cause damage to the body and different organs. And mainly, like I mentioned, the first one is a direct cytotoxic effect. So as a virus attached to the ACE receptors in different organs and systems, it will cause direct cytotoxic damage. All right, so the route of entry, once again, is the lung and the GI, but it may then spread and affect other organs, namely your heart, your brain, your liver, your kidneys, and so on. All right, so then what happens is the body's immune system to fight COVID then kicks in, and there is going to be excessive inflammation, not just in the lung, but also in many other parts of the body. And sometimes the immune system overreacts, and that may cause then the dysregulation of the immune system. But in any case, this is the continuous and the excessive inflammation that affects many different organs inside the body. And as the inflammation persists, okay, it's going to cut off blood circulation. It may cause blood clots and decrease blood circulation. And eventually, that will cause injury, death, or apoptosis to many cells and tissues and organs. All right, so once again, what starts out as lung injury or GI injury may then spread and cause injuries and death of the cells or the tissues in many different organs. All right, so basically in acute cases and in chronic cases, we start out by focusing on the lung, but later on, to best treat the entire patient, we also have to focus on treating many other organs. All right, and then what happened is this article then goes on and talk about different options as far as TCM treatment is concerned, with the emphasis on three main things. One is to use herbs that have antiviral effect. So these are mainly the heat-clearing herbs that have antibiotic effect, but more specifically antiviral against the coronavirus or SARS-CoV-2. All right, so these are the herbs and classes that we discussed already last year. Basically, herbs such as Jinlinhua, Lonicera flower, Lianqiao forsythia, Banlangen, and Da Qingye, the Isatus root and leaf, and so on and so forth. And obviously, these are the herbs that we primarily use to treat the patient as they have the COVID infection. Once they are over the COVID, these herbs are not necessary anymore. At that point, you need to use other herbs. If they still have continuous inflammation, then we need to use herbs that have anti-inflammatory effect. And once again, a lot of these herbs are still going to be the heat-clearing herb. But the difference is that there are some heat-clearing herbs that are antiviral herbs. There are some heat-clearing herbs that are antibacterial herbs. There are some heat-clearing herbs that are anti-inflammatory herbs. So if you are treating the post-infection phase where they have continuous inflammation, then you need to switch gear and select the heat-clearing herbs that have anti-inflammatory effect. That way you will get the most out of these herbs to reduce inflammation. So some of those examples include 大黄, rhubarb, and this is actually a downward draining herb. It's not even a direct heat-clearing herb, right? You also have 黄芩, Scutellaria. You have 广藿香, Pocostemon. 丹参, Salvia. Salvia is actually a blood-moving herb, but it does have good effect to reduce inflammation. And then lastly, 石膏, gypsum. So as you can see, these anti-inflammatory herbs primarily come from the heat-clearing category, but they can also come from other categories as long as they have heat clearing as a secondary or tertiary effect. So it's important to remember when to choose which herb. So basically, depending on the patient's pattern, choose one that is most appropriate. All right? And lastly is herbs with anti-apoptotic effect. So what that means is these are the herbs that will help to alleviate the death and injuries of the organs to help to restore the form and also the functions of these organs. And basically, if you think about it, the injury and death of the organs and tissues is basically indeficiency, because in represents the form and yang represents the function. So when you have indeficiency, basically that means the organ has been damaged. There's some damage, there's some injury, there's some atrophy. And what happens is when there is damage to the organ, to the form, there's also compromise to the function, because one cannot exist without the other. So when the yin is deficient, generally speaking, yang is going to be compromised as well. But in this case, if you're looking at the damage of the organ, then you want to use mainly the yin tonic herb to help to restore the forms of the organs. So most of these herbs are going to be yin tonic herb, but not necessarily all of them. So once again, this is one part of the pharmacological effect of the herb, sometimes the same as the TCM categorization, but other times it could be the secondary or the tertiary TCM function. So some examples here include 枸杞子, which is a lycium fruit, 红景天, which is a rhodiola. There's also 黄芪, astragalus, 厚朴, magnolia, 黄芪, Scutellaria, and so on. So you can see there are some yin tonics, there are some qi tonics, such as 黄芪. There are qi moving herbs, such as magnolia, 厚朴. There's also heat clearing herbs, 黄芪, Scutellaria, and 大黄 rhubarb. And then blood moving and also stop bleeding herbs, such as 山七, noto ginseng, and 川芎, cnidium. Okay, so once again, in order to help to restore the forms of the organ and the function, it really depends on which herb you want to use and also what TCM patterns are. While most of the herbs are going to be yin tonic herbs, there are herbs in other categories as well. All right, so once again, keep this in mind when we look at the whole picture and you decide which herb to use to help to restore the organ form that also meets the TCM pattern. That's how you can get the most out of it. Okay, so this particular study is actually good to introduce both at the beginning of today's class and also at the end. The beginning implies or means that we need to understand what all these organ injuries mean from both a TCM and Western medicine perspective. And also, it's good to know the pharmacology of the herb. So as you decide how to best treat the patient, you come up with your TCM diagnosis, you come up with your core formula, and as you modify the core formula, you can always add in some of the herb that fits both the TCM pattern and also the Western pharmacology of the herb. And I think that's the best way to identify the most specific and the most useful single herb when you modify the formulas. All right, so as far as the formula goes, how do we start looking for the formulas to treat these post-COVID patients? And like I mentioned in last year's class, this is basically the second class I talked about how coronavirus is treated with TCM in China. We talked about the three particular protocols from a regional, provincial, and national approach. Basically, in all three of these protocols, they recognize recovery period to be very important for near or complete recovery post-infection. All right, and as we dive into these in detail, basically it's fairly simple. They recognize in all three protocols that the primary overlap or the primary thing to focus on is lung and spleen as the zangfu organ that's most affected, and also qi and yin deficiency as the two main things. And lung and spleen, of course, and the reason is because that's where the virus primarily enters the body, through the lung, through the GI tract, by attaching to the ACE receptors. All right, so you have a lot of lung damage and also digestive tract damage. And then, like we mentioned, what happened is as the infection creates heat in TCM, the heat in turn will damage the yin and also damage the qi. So yin refers to the damage of the organ itself and qi refers to the function. So you have compromise, injury to the organ and compromise to the function. So lung, qi and yin are both deficient and damaged, and spleen and stomach, qi and yin are both deficient and damaged. So in all three of these protocols, the primary focus is to restore and tonify the spleen and the lung, to nourish yin and to tonify qi. So that's basically the theme across all three of these protocols. And as far as Hubei Provincial Hospital is concerned, the formula they choose is a formula called Sa Shen Mai Dong Tang, which is Glenea and Ophiopogonus decoction. And if you were to look at the first few herbs, you have Sa Shen, which is Glenea or Adenophora. You can use either one, which is fine. You have Mai Men Dong Ophiopogonus. So both of these are going to be yin tonics. So these two herbs tonify the yin of the lung and yin of the stomach. So basically the lung and the digestive system. And then you also have Ren Sen, which is ginseng, and this is to tonify qi. So once again, this is to tonify qi, this is to nourish yin for the lung and also for the spleen. Okay, so that is the most important focus of this formula. Okay, and obviously it fits the diagnosis. All right, and if you look at the Wuhan Union Hospital, so this is where COVID was first discovered in the Wuhan city. Once again, the diagnosis, the treatment focus is to strengthen the lung and the spleen, to tonify qi and to nourish yin. Okay, and they use a customized TCM formula. Okay, so if you look at the ingredients, you can see once again, it's very similar to the Sa Shen Mai Dong Tang. So once again, the first formula is Sa Shen, Glenea, and Adenophora. Second herb is Mai Men Dong Ophiopogonus. So the main ingredients are the same. And then if you go a few herbs down, instead of Ren Sen, Radix ginseng, this formula uses Xi Yang Sen, which is American ginseng. And that's not a bad idea because Xi Yang Sen is not as warm. So it tonifies qi, but also generate body fluid at the same time. So Xi Yang Sen is a good substitute for Ren Sen if you think Ren Sen is going to be too warm. Okay, and the rest of the formula is very similar. And once again, the main focus is to treat the lung and treat the spleen, to tonify qi and also to nourish yin. So if you get that main direction correct, generally speaking, the patient will do well. All right? And the last part is the national guidelines or national protocol from Beijing on how to best treat the patient in the recovery phase. So in this particular case, it's not just one formula, but rather they divided into two specific diagnoses and two separate formulas, depending on whether the patient had more deficiency of the lung and spleen or more insufficiency of qi and yin. All right? So if the lung and the spleen deficiency is more pronounced, so these are the signs and symptoms, then basically the formula will focus a little bit more to tonify the lung, tonify the spleen, and tonify qi. right? So in this case, you can see there's Dangsen Coronapsis. So once again, this is a substitute for Rensen ginseng or Xiyangsen American ginseng, because Dangsen is not as strong, it's milder, it's gentler, it's also a lot less expensive. And then Huangqi astragalus is also added. There's Baishu, Atractylotus, and Fuling. So as you can see, this is the core of a formula called Senling Baishu San, slightly modified, of course, right? So once again, the core of the formula is to tonify qi, and then of course some herbs are added to dry the dampness and prevent the accumulation of damp and phlegm as you use qi tonics. Okay, and then the other diagnosis and corresponding formula is the insufficiency of qi and yin. A lot of the similar signs and symptoms. And the formula, once again, in this case, focus primarily on nourishing yin and tonify qi. So you have Nan Sa Sen and Bei Sa Sen both used, Adenophora and Gallenia. You have Mai Men Dong, Ophiopogonus. So these three are to nourish yin. Then you have Xiyangsen, American ginseng, and this is to tonify qi. So once again, even though you have a provincial, regional, and national guidelines, once again, you can see the overlining theme, which is to tonify the lung, tonify the spleen, nourish yin, and also tonify qi. So once again, this is a theme from all three protocols. And beyond the protocol, what we then see is since that time, there have been thousands of literatures that have been published. And if you go to different databases, you can actually do research and find many of these research published. Obviously, majority of them are about Western medicine, but there's no less than a few hundred that are TCM. I went through about 200 of these articles and about 100 of them in greater details. And then for the rest of for the next 30, 40 minutes or so, I'm going to share with you what I found to be the most useful. All right. So to follow up on our theme, the general treatment for post-COVID, as far as this article is concerned, prevention and treatment of COVID-19 using traditional Chinese medicine, a review. So this is an article that reviews many of the studies that have been published and basically put it together all in one place. And the approach or summary of this article is very similar to the three regional, provincial, and national protocol that we mentioned. So there's a prevention stage, observation stage, treatment stage, which is separated into initial, middle, severe, and critical. But at the end is the recovery stage. All right, so this is the one area that we're going to focus on today. So once again, for the recovery stage, the TCM syndrome differentiation is primarily lung and spleen qi deficiency. And the treatment method is to nourish yin and tonify qi. And the formula recommended is a formula called decoction of Mai Wei Bu Zhong Yi Qi Tang. So basically, Bu Zhong Yi Qi Tang refers to the classic formula, tonify middle and augment qi decoction. And then Mai Wei refers to Mai Men Dong and Wu Wei Zi. So basically, this is a formula that uses Bu Zhong Yi Qi Tang as a primary formula to tonify qi, and then Mai Men Dong, once again, to nourish yin. So overall, the focus is still the same, to tonify qi and to nourish yin. All right, so basically, you have an agreement between the state or province and national protocols and also the research studies. All right, so the first general approach is pretty much the same. But like we mentioned, what happened is the post-COVID-19 syndrome really goes beyond just the lung and the spleen and stomach. Many other organs are affected. So what happened is in all these initial protocols, they emphasize mainly on the lung and the spleen, the qi and the yin deficiency. But what happened is as many of the patients are hospitalized, they have severe COVID-19, they are discharged, what happened is they have damage in many other organs. So these generic protocol doesn't go into those specific cases. And this is where I went into all those medical journals to research as much as I can and share with you basically what have been found to be most effective to treat these specific complications of sequelae and also what are the treatment protocols. All right, so we'll go ahead and start. Once again with the lung. So not just the qi and yin deficiency, but one step beyond that. So what happened is for patients that are hospitalized, what happened is the coronavirus have done severe damage to the lung. All right, they have done severe damage to the lung cells to cause a lot of inflammation, a lot of fluid retention, and also a lot of damage to the cells. So in Western medicine, they basically call this a scarring, okay, scarring of the lung, even as a patient no longer has the virus. In Chinese medicine, in early stages, this can be thought of as phlegm accumulation, okay, and later on, as the phlegm blocks the circulation, as the cells slowly die, then you have pulmonary fibrosis. All right, so in the beginning, it's phlegm accumulation, and later on, as the lung cell dies, then it becomes blood stasis. Okay, so once again, Western medicine is scarring or pulmonary fibrosis, and TCM description is accumulation of phlegm or blood stasis. All right, so once again, this is a overview of many of the studies that have been published. In fact, they went through 3 electronic database to gather all the records. All right, and this is another article that talk about TCM and treatment of pulmonary fibrosis. So what happened is many different studies, of course, have slightly different approach, and they have slightly different recommendation or herbal formula. But by and large, the diagnosis is two things, either phlegm accumulation or blood stasis. And as you can see from the arrow, many of the formulas, many of the studies recommend the formula called 血府煮鱼汤, which literally means drive out stasis in the mention of blood decoction. So mention of blood is the heart. So basically this is a formula primarily used for blood stasis in the upper jaw. Okay, so historically, you can use this for patients with coronary artery disease, with blood clots, with pulmonary embolism, basically blood stasis in the chest area. All right, so this was a primary formula used for pulmonary fibrosis or lung scarring in post-COVID patients. And as you can see, there are many herbs in here that are primarily blood-moving herbs. So the idea here is you want to improve blood circulation to the lung, to the chest, to help the body to help itself for the healing and recovery. Okay, because if the blood doesn't get there, because there's chronic inflammation, there's chronic fluid retention, and buildup of phlegm and so on, if blood cannot get there, then the patient's lung and the lung cell cannot heal and recover. So basically, that is one of the most important things to do. So this has been recognized as a primary formula for that purpose. And then obviously, if the patient has any other complications, which may be continuous inflammation, which may be immune dysregulation and so on, then what you can do is add the single herbs that we mentioned earlier today that fits the blood stasis pattern, and then that will make up your final formula. All right, so you don't need to use the classic formula as is. Always think about how you can modify and customize a formula to get even better results to treat the patients. All right, so these are the classic information as far as the function of the formula and also what the classic signs and symptoms and indications are. All right, this one is another study. This is in Chinese. Unfortunately, the entire article is in Chinese, but at least the abstract is in English. So the title here is Feasibility of Yi Qi Xuan Bi Tang Decoction to treat pulmonary fibrosis after new crown pneumonia. New crown pneumonia basically refers to the COVID-19 induced pneumonia. So basically, this article goes on to talk about their experience in treating pneumonia in COVID-19 patients and what their thoughts are. So basically, the conclusion is the diagnosis is primarily two things. The patient had deficiency of the lung and spleen, and also deficiency of qi and yin. So this part is the same as what we have talked about so far. And then specifically for pulmonary fibrosis, their diagnosis is phlegm accumulation and blood stasis, blocking the channels and collaterals. All right, so like we mentioned, post-COVID patients all have the common denominator of lung and qi deficiency, qi and yin deficiency. But those with pulmonary fibrosis also have phlegm accumulation and blood stasis. So the formula they have found with the best effect, and they call it 益气宣闭汤, which translates to benefit qi and disperse B decoction. B is the painful obstruction. So this is not a classic formula. This is relatively new. This is their contemporary formula. So you're not going to be able to find this as a commercial formula, but rather you have to take this formula and then either copy the exact composition or modify it as you see fit. Unfortunately, the formula did not give the exact dosage of the herb, but just a list of all the herbs. And the only herb that they give you as far as dosing goes is huangqi, astragalus. And the reason is because they emphasize that this is the most important herb in the entire formula and that you need a large dose in order to get the desired effect. And the dose is 30 to 60 grams, and that's actually quite high. The normal dose used to tonify qi is usually around 9 to 12, 9 to 15 grams. So this is about somewhere between 3 to 6 times the normal dose, okay? So in this case, what happened is the use of huangqi is not so much just to tonify qi or to boost the immune system, but it has a completely different use, okay? And I'll save that reason until a little bit later when we get to the pharmacology of this herb. But in any case, as you can see, this formula, as the diagnosis tells us, is primarily to tonify the lung and the spleen, tonify qi and nourish yin, okay, and also to eliminate phlegm and treat blood stasis. There are herbs here that tonify qi, such as huangqi, baisu, ganchao. There are herbs that nourish yin, such as huangjing. There are herbs that eliminate blood stasis, such as dilong, ferritima, and so on and so forth. And also chisao, red peony. So basically the formula does what diagnosis says it should do. And then, like I said, it doesn't have the dosage, but I think in most cases, if you use the normal dosage, you should be able to get desired effect for treating pulmonary fibrosis. And this article goes on to say that if the patient has lung and spleen qi deficiency with residual dampness and toxins, which means there's a lot of phlegm, there's a lot of cough and sputums, and maybe the infection or the inflammation is not completely clear, and that's why there's toxins. Then you need to add herbs such as guanghuo xiang, pocostemon, yiyi coisus, peilan, eupatorium, and also zisugeng, which is perilla stem. If there is qi and yin deficiency along with yin deficiency heat, so the yin deficiency heat means the chronic residual inflammation, or perhaps the immune dysregulation with continuous inflammation. So once again, the infection is gone, there's residual damage to the lung and to the digestive system, and also continuous inflammation. And the continuous low-grade inflammation is basically your yin deficiency heat at this point. So in this case, you need to add Sarsen glania or adenophora, 麦门冬 Ophiopogon, 知母 Anemarina, and Qinghao Artemisia. So the first two are to nourish yin, last two are to clear the deficiency heat. Okay, so once again, you don't need to rely on a classic or fixed formula. Remain flexible, adjust the formula as needed, because once again, COVID-19 hits the lung and the spleen the hardest, but also can damage many other organs. So depending on what other organs are damaged, you need to expand beyond a fixed or a classic formula to customize, modify the formula so you treat everything that you see in the patient. All right, next is COVID-19, the virus, can also easily attach to the ACE receptors and therefore damage the heart, damage the blood vessels, and the cardiac system. All right. So in this case, there's an article here, Traditional Chinese Herbal Medicine at the Forefront Battle Against COVID-19, Clinical Experience and Scientific Basis. So they talk about both the TCM perspective or clinical experience and also scientific basis. What are the clinical findings? So in this case, it uses not so much the stage of COVID as the category of where to proceed, but rather some of the most commonly used TCM formulas. So on the left-hand side, you can see there are some classic formulas, such as麻杏丝甘汤, 甘草干姜汤, 色甘麻黄汤, right? But you also see some of the contemporary formulas that are made specifically to treat COVID. And obviously the most famous is 清肺排毒汤 or 清肺排毒 decoction, all right? So different formulas address different things. And then at the very bottom here is you have one formula called 生脉散, literally means to generate the pulse powder. And this is a formula for lung and kidney qi deficiency and also heart and lung qi deficiency. So primarily this is a formula for heart and lung qi, heart and lung yin deficiency. As the patient suffers from chronic disorder, that as the body goes through chronic wear and tear, it becomes more and more deficient. And as a result, there's lung deficiency, there's heart deficiency, there's qi deficiency, and also yin deficiency. So this formula, once again, tonifies qi, nourish yin, primarily focus on the heart and also on the lung. So you have ren sen, which is to tonify qi for the lung and the heart, and also mai dong or theopogonus, which is to nourish yin. And wu wei zi is an astringent herb to help to astringe and bind the qi. So while the patient is very deficient, they don't lose even further more of the qi. So this is a very simple formula for those patients, or in this case, the chronic post-COVID patients who have both lung and heart, qi, and yin deficiency. Okay? And these are the classic description of the formula functions and also the classic signs and symptoms, clinical manifestations. All right. If we keep moving forward, we come to the next topic, which is the post-COVID patients who have gastrointestinal complications or sequelae. So in this case, they may have continued diarrhea, nausea, vomiting, abdominal pain, anorexia, poor appetite, chronic fatigue, and so on and so forth. Okay, so this is an article that addressed specifically in this area. It's titled, Reflections on Treatment of COVID-19 with Traditional Chinese Medicine. So it talks about the advantage of TCM in treatment of COVID-19, including the relief of symptoms, retarding the development from mild and moderate to severe, improving the cure rate, reducing the death rate, and also promote the rehabilitation. All right. So anyways, the first parts are to talk about the medical observation, the mild case, severe case, and critical case. So this type of breakdown is very similar to the protocol that we mentioned earlier. And obviously, our main interest in this case is a convalescence. And the recommended formula in this case is a Senling Bai Su San in capsule form. So like we mentioned earlier, Senling Bai Su San is a great formula specifically to tonify qi of the spleen and stomach. Okay, so Ren Sen, Fu Ling, Bai Su are the three main herbs. Okay, and earlier when we see this formula, we see it in a slightly modified form. Ren Sen or ginseng is sometimes replaced with Xi Yang Sen, American ginseng, or sometimes replaced with Dang Sen, Cotonopsis. But in its original form, it does have Ren Sen, which is a stronger, warmer herb. So once again, if that's fine, that's okay. If not, then replace it with substitutes as needed. So you have Ren Sen, Bai Su, Fu Ling, and Gan Cao as your main herb. You also have San Yao to nourish yin, okay, and other herbs to dry the dampness. Okay, so this is a great formula, once again, to treat the post-COVID-19 patients that have a lot of digestive issues. Okay, so this is a great formula to tonify the spleen and stomach qi. And this is the classic functions of the formula as well as the TCM manifestations. Okay, this next part is on the post-COVID patients who have liver issues. Basically, the liver is also suffering from injuries and also damage, where you have increase in liver enzymes, increase in bilirubins, and maybe early stage of something more serious. All right, so this article is titled Clinical Characteristics and Impacts of Traditional Chinese Medicine Treatment on Convalescence of COVID-19. Basically talking about TCM to help to balance the immune system, improve hematopoiesis and coagulation, enhance functions of heart and liver, increase nutrient intake and lipid metabolism. Okay, and one part here is specifically to talk about what are the 3 best ways as far as use of herb is concerned. The first one is on use of 森林白术散. So once again, the spleen qi, like we mentioned in the previous case. This study also emphasized quite a bit on 小柴胡汤, and the last part is personalized formulas. We're not going to talk about personalized formula because that really depends on whatever the case the patient may have. But one of the 3 very good emphasis that we can learn from here is the use of 小柴胡汤, because they use this formula specifically to treat post-COVID patients who had injury to the liver. All right, so this is the composition of 小柴胡汤. Basically, you have 柴胡, popularum, 黄芩 Scutellaria, 半夏 Pinellia, 生姜 fresh ginger, 人参 ginseng, 炙甘草 licorice, and also 大枣 jujube. Historically, this is a formula that harmonizes Shaoyang syndrome. Okay, but what we know today is that this is a great formula to treat all kinds of liver disorders, starting from elevated liver enzymes to hepatitis all the way to liver fibrosis. And in fact, this is one of the most frequently used formula in Asia for patients that abuse alcohol too much and end up with liver cirrhosis. Okay, so this is a very commonly used formula in Taiwan, in China, especially in Japan, as far as herbal treatment of alcohol-induced liver problems. And what they found out in this particular case is that 小柴胡汤 is also a great formula to use to prevent and treat liver disorder associated with COVID. And this is a study that lists out the patients that have not gotten the treatment, so that's the non-treatment group, and also the TCM treatment group, how their liver functions compare, whether they get 小柴胡汤 or not. And basically, to make a long story short, their conclusion is that the use of 小柴胡汤, the present study suggested that TCM is safe for convalescent COVID-19 patients and has protective effect on the liver. All right, so once again, if you have post-COVID patients who have liver disorders, this 小柴胡汤would be the best formula to use. All right, moving forward, if the post-COVID-19 patients have renal issues, so once again, this is damage to the organ kidney, not so much just the function of TCM kidney. All right, and this article specifically talk about potential mechanism of Chinese herbal medicine that implicated in the treatment of COVID-19 related renal injury. So basically, we talk about Chinese herb having a lot of success in China to battle COVID-19 and specifically to treat renal injuries. And first of all, what they found out is that of the patients that suffer from severe COVID-19 that are hospitalized, a lot of them, in fact, suffer from severe kidney dysfunctions. 59% with proteinuria, 44% with hematuria, 14% with increased blood urea nitrogen, 10% with increased serum creatinine, and 29% with acute renal injury. So obviously, this is quite serious. In Western medicine, generally speaking, these patients really don't have very good treatment. Basically, if necessary, they will go through dialysis, but there's not much in between that can be done. But fortunately, in Chinese medicine, Chinese herb seems to be very beneficial. And what they have then described, what this article then described, is that the main damage, anatomy-wise, to the kidney, is that there is tubular epithelial cell degeneration and shedding. There's renal interstitial congestion. There's microthrombi and focal fibrosis. And what that means in TCM term is that when you start to have renal interstitial congestion, obviously that means there's a lot of inflammation, there's a lot of fluid buildup. So this is basically the damp and phlegm accumulation. And then as you have microthrombus, so that's blood stasis, and focal fibrosis. Fibrosis is hardening of the tissues, so that's blood stasis. So basically, as there is congestion that blocks the blood circulation, blood cannot get to the local area. So the tissues start to suffer injury, they start to have blood clots, start to have fibrosis. So in Chinese medicine, that's the blood stasis. And lastly, when you have tubular epithelial cell degeneration, so cells are going through degeneration, they are shedding, they are going through atrophy. So that's then the insufficiency. So basically, as you look at these patients, they have dampened phlegm accumulation, they have blood stasis, and they have insufficiency. So your treatment protocol is basically to eliminate the dampened phlegm, to move the blood, eliminate blood stasis, and lastly to nourish in. So that is the main focus you want to consider as you think about how to identify the pattern and how to treat the patient. And then interestingly, I think what happened is these researchers are Western researchers. They are not really TCM practitioners. So they gather all the study that's published, they look at all the prescriptions, and in fact there were 207 prescriptions. And then what they do is they did a lot of data crunching, and they identify the most commonly used Chinese herbs for treating renal injuries in COVID-19 patients. And you don't usually see this from TCM analysis. You see this from data analysis, statistical analysis. So they went through all these data crunching and concluded Huangqi, astragalus, to be the #1 herb for treating renal kidney damage. And you may think that makes no sense, right? Because in most cases, when you have renal compromise in Western medicine, you have edema, you have fluid accumulation. So the herbs you want to use are really herbs that have effect to drain the fluid, to eliminate dampness, and to help to treat edema and dysuria and so on. So #2 herb, Fuling, Poria, would make a lot of sense. #3 herb, Atractylotus, Baisu, would also make a lot of sense. And same with #3 and #4, Shengdi, Huang, Rumania, and Sanyao, Dioscorea, because they nourish in, right? And they help to nourish kidney in. But #1 herb really doesn't make any sense. And this goes back to our question earlier in the beginning, in that patient that had pulmonary fibrosis. In that formula, Huangqi, astragalus, was also the #1 herb, and also at a very high dose. Same thing here, patient with renal damage and renal fibrosis. Astragalus is also the #1 herb and probably a very high dose. So you have to wonder, why is Huangqi used here so commonly and at such high dose? Is there a function of Huangqi that's beyond the classic tonifying the qi? All right, so we'll get to that in just a minute. All right, this next category here makes some sense, right? This is to define of all the herbs that are used for treating renal dysfunction, what chapter they belong in the TCM herbal materia medica. And #1 is diuretic, damp, excreting medicine. So once again, that makes perfect sense. Herbs like Fuling and Zuling would belong in here. And #2 may not make that much sense. Qi reinforcing herb or qi tonic herb. And that's where Huangqi belongs. And you can tell these two categories are much more commonly used than everything else, right? Qi activating, that would be Dansen salvia. And like we mentioned, once they start to suffer from fibrosis, that's blood stasis. So Dansen needs to be used to improve blood circulation so the body can help to heal itself. And the rest are not quite as significant. All right, so now let's look at Huangqi and why it's so important. And the reason here is that Huangqi, from a TCM perspective, is primarily a qi tonic herb. So we use it for patients that's weak and deficient and immune compromised to boost the immune system. But what many of us probably don't realize is that Huangqi is not just an immune stimulating herb, it's also an immune modulating herb or immune regulating herb. And what that means is that it doesn't have a one directional effect to just boost the immune system. Okay, it also helps to regulate. So when the immune system is hyperactive, you will have to bring it down. When it's hypoactive, you will have to bring it up. And how it specifically does that is that when immune system is weak and you give Huangqi, what it actually does is it increases the stimulation and proliferation and generation of the immune cells. So it helps with the T helper cells, the T killer cells, the macrophage, and the B cells. So basically the T and B cells. But when the immune is hyperactive, okay, there's too much of the pro-inflammatory cytokines, whether it's cytokines or tumor necrosis factor and so on. Huang qi will actually help to bring down those pro-inflammatory cytokines. And what happens is the pro-inflammatory cytokines that actually damage a lot of the internal organs because it's causing too much damage when it's no longer necessary. So if you remember back to the term cytokine storm, right? What happened is there's way too much cytokine produced that's not necessary, that's causing the damage. So Huang qi actually will help to suppress, or not suppress, to regulate the excess amount of cytokine to bring it down. So it will calm down the cytokine storm and therefore reduce the hyperinflammation, which then leads to the damage and inflammation and the fibrosis. So basically, that's why Huang qi is so helpful in patients that have fibrosis. Whether it's pulmonary fibrosis, it's used at a very large dose, or in this case, the renal fibrosis is also used the most frequent. And if you want to go one step further, Huang qi, as you can see here, reduces the renal fibration by inhibiting the interleukin, the tumor necrosis factor alpha, and also COX-2. It helps to protect the kidney by reducing the microthrombus and inhibiting the NAPK pathway, basically to slow down the cell apoptosis, cell death, to slow it down. Alleviate the apoptosis and necrosis of the renal cells. Alleviate the renal fibrosis by inhibiting the CASP3 activation. So once again, like I mentioned, it has an effect to regulate the immune system, to reduce the inflammation and reduce the death of the cells, and also the fibrosis of the organs. All right, so Huang qi, this particular effect, I don't think is clearly described and utilized in classic TCM materia medica. So something quite new, but something I think is very, very useful as we treat a lot of these chronic disorders, whether it's post-COVID-19 or autoimmune disease that leads to a lot of fibrosis of the internal organs. And then on top of that, if you need to incorporate Huang qi into a classic formula, and like I mentioned, in this particular study, there were 207 classic formulas. And the reason why they had 207 classic formula, I think, is because when your kidney suffers from dysfunction, it's not able to eliminate whatever junk that's built up inside our body. So even though your cause is kidney dysfunction, your symptom can vary widely depending on whatever toxin that's built up inside the body. So it's hard to come up with a one protocol or one formula that's good for all patients with kidney dysfunction and then whatever signs and symptoms they show. So you need to use a formula that's good to help with the renal elimination. That's what these formulas are on this slide. You need to add Huang qi astragalus to restore the kidney function to prevent the fibrosis, and then whatever other signs and symptoms the patient shows, then add the herb to help with those signs and symptoms as well. So like I said, it's hard to come up with one formula for everything, but rather you need to make customized formulas. All right? Thromboembolism, basically blood clots, is also something that's quite common with post-COVID patients. And what happens is these virus, once again attached to the ACE receptors in the blood vessels, damage the blood vessels, and end up with clotting issues. Okay, I did not find a specific article that addressed clotting associated with post-COVID patients. So I can't present a clinical study. But if I were to, if I had to, okay, these are the formula that I would lean on. These are the 5 classic formulas that help to treat blood stasis in different parts of the body. So Tong Qiao Huo Xue Tang is mostly for the head. Xue Fu Zhu Yu Tang is for the upper jiao or the chest area. Ge Xia Zhu Yu Tang is for the middle jiao, which is the middle third of the body. Sao Fu Zhu Yu Tang is for the lower abdominal area. And then lastly, Shen Tong Zhu Yu Tang is for the extremities, your arms and legs, the limbs, and so on. All right, so depending on where the risk is, you can select the formula based on the region accordingly. Okay, and then lastly, the post-COVID-19 patients, it's not just a physical or organ disorder, it's also a mental and neurological condition as well. So a lot of these patients, either from the disease itself, either from the quarantine, either from lack of social contact, they have a lot of mental and psychological issues. So it's very important that we treat the body, but we also treat the mind as well. So this is one article that specifically talks about the perspective of TCM to treatment of mental disorders in COVID-19 survivors. All right. So basically, their conclusion is to jump to the bottom line that you start with insufficiency, which then leads accompanied by excessive yang. So basically, you have insufficiency and also heat, and that then disturbs the heart and causes a lot of mental conditions. And mainly, these patients will have anxiety, depression, insomnia, and also PTSD, post-traumatic stress disorder. And the formula recommended to use, number one for depression, are lily bulb and Rumania decoction, lily bulb and animarina decoction. And these two are actually new formulas, so you're not going to find them in classic textbook. The first one is pretty simple. Basically, it's lily bulb, which is bai he, and Rumania, which is Sheng Di Huang, basically just 2 herbs. The second formula is 3 herbs. Yeah, lily bao, bai he, Rumania, Sheng Di Huang, and then animarina, which is zimu. So basically to nourish in and has a stronger effect to clear heat in these patients. The last one is a commonly used classic formula, which is gan mai da zao tang. So gan refers to gan cao, licorice. Mai refers to mai ya, which is wheat. And da zao is jujube. Okay, so basically 3 herbs. And this is a formula historically used for restless organ syndrome, in which there's a lot of in and body fluid deficiency and also deficiency heat. So this, I think, would be a great formula to use for depression. All right. As far as anxiety goes, suan zao ren tang, the Ziziphus decoction, is the recommended formula. So I agree, this is a very good formula for anxiety, for insomnia type of problems, shen disturbance type of problems. The second one is huang lian a jiao tang. So huang lian implies to clear heat, and a jiao is to nourish yin. Okay, so this is a classic formula, but you're probably not going to be able to find it easily. It's not commonly used. And also zhi zi qi tang. So this is gardenia and soybean decoction. So once again, also a classic formula, but not commonly used. So between these 3 formulas, suan zao ren tang is the most common and probably the best out of the 3. All right. And lastly, for PTSD, this article recommends lily bulb and Rumania decoction. So once again, it's a combination of 2 herbs, lily bulb, bai he, and also Sheng Di Huang, fresh Rumania, basically to nourish in and clear heat. And the second one is a classic formula called Gui Lu Er Xian Jiao, which is a formula with deer antler and tortoise shell formula without the 2 other ingredients to nourish the kidney yin. This formula actually is much more effective to treat kidney yin and kidney jing deficiency in the form of osteoporosis. But I guess what happened is a lot of patients with PTSD, it's a very traumatic disorder and also something that over time does cause a lot of wear and tear, a lot of kidney deficiency. So if that's the case, that will be fine. Okay, but once again, you're probably not going to be able to find this formula easily. So you either have to make it up from scratch using the 4 herbs, or use other formula that also tonify the kidney yin, such as Da Bu Yin Wan, or the restore the kidney formulas. Okay, so those will be fine too. Or Liu Wei Di Huang Wan will be okay, Rumania 6 formula. And then finally, in addition to using Chinese herbal medicine to treat the patient, which is herbal medicine, the physical exercise and the rehabs are also extremely important. Okay, so this is something that in China, patients do know and do on a regular basis. In the US, it's usually physical therapy, but for those patients who are interested, we can also show them how to do these type of exercise. The most common, of course, is Tai Chi Quan. Okay, so this is basically a household term. You know, a lot of people, in fact, know this and do this. And also one called Ba Duan Jin, which is the 8 brocade. And I would say between the two, Ba Duan Jin, the 8 brocade, is more suitable. And the reason is because Tai Chi Quan requires longer time to learn. it requires a larger space and also more physical balance and agility. And what happened is for a lot of post-COVID patients, if they are very weak and very fatigued and have not done this before, it will be kind of hard to learn. And if they are also quarantined at home for whatever reason, during the exposure time, probably not enough space at home to do the entire Tai Chi Chuan. 八段锦, on the other hand, doesn't require much space. Basically, if you can form a little circle with your arms, that's about all the space you need. Okay, so that will be more suitable. And in fact, does it sound okay? In fact, there are quite a few clinical studies that have been published specifically on rehab using different TCM exercise. And they have all shown to be much more effective than no physical exercise whatsoever. All right, so there are many different forms like Tai Chi Chuan that we mentioned, 八段锦, 六字诀, and also different meditation and breathing exercise. So in this particular case, this article talk about two main things. One is a modified rehab exercise, basically modified 八段锦, specifically to help with the lung functions, and then incorporating the acupressure at the same time. All right, so you can get to the article via this link and also see the video at the same, at the link. Okay, so that will take you to exactly where you need to go. You can learn it and also share it with the patient. All right, so this is an image from the video itself. Okay, and these are the points that you can show the patient to do acupressure along with the physical exercise. Lung 2, lung 11, lung 10, and also lung 7. All right, and this is the comparison before and after. Okay, baseline and after 1 month. And you can see basically out of the 60 patients, their lung signs and symptoms, dry cough, productive cough, difficulty in expectoration, and dyspnea are significantly improved. And it's quite interesting, and the reason I say that is because there are so many clinical studies that have been published on acupuncture, on acupressure, on moxibustion, on herbs, to not only for prevention and treatment of COVID-19, but also on Tai Chi Chuan, 八段锦, and so on for post-COVID-19 recovery. And probably no less than 10 that I've come across. And this is only one of the many that I'm sharing with you because of the time constraints. All right, so in the end, what happened is, if you remember nothing else from this last lecture, it is that in a normal state, this is going back to TCM 101, you want your yin and yang to be balanced, and that's basically how you can get optimal health. And what happened is with COVID-19, infection and inflammation is a heat disorder. So what's going to happen within the heat disorder is that your heat or your state of yang is going to be elevated, and as a result, the heat and the yang will consume yin. And at the same time, if they are getting drugs, whether it's antibiotic drug, antiviral drug, these drugs are usually bitter and cold in nature from a TCM perspective. So bitter and cold type of drugs will damage qi and consume yin even further. Same thing with the Chinese herb. During the time when you're treating the infection, we use a lot of herbs that are bitter and cold. And once again, they also damage qi and consume yin. So the formula ideally would also have some herbs to tonify qi and nourish yin. But if not, once again, they will consume yin further. So generally speaking, one way or the other, as a result of the disease, as a result of the treatment, generally speaking, after the treatment, you're going to look at more yang and less yin in conclusion. So basically, that's where we have the yin deficiency, qi deficiency, and also deficiency heat combination. All right. If that's too much to remember, just remember there's more deficiency heat and there's less yin. There's more yang and there's less yin. And if you can remember that, if you can focus on your treatment to help to gradually bring down the yang and bring up the yin, then you are heading the right direction. And that's the same conclusion from one of the most famous TCM practitioner named Zhu Danqi. His conclusion in TCM is that yang 常有余, yin 常不足, which means yang is often in excess and yang is yin is often insufficient. All right, so keep that in mind as a guiding principle as you treat both acute and also post-COVID patients. And then lastly, Zhang Boli is the primary figure in China as far as coming up with the suggestion on how to best treat COVID for prevention, for treatment, and also for recovery. And we are now past 1 year into the onset of COVID. And basically his conclusion is that remember to address both the physical and physiological aspect of the disease. So once again, that's the body and also the mind. Make sure to focus on the primary organ and also the associated or the secondary organs. So the primary is the lung and the spleen, or lung and the digestive tract. The secondary are the heart, kidney, brain, liver, and so on. Okay? Utilize all the TCM tools, acupuncture, acupressure, herbs, and also Tai Chi Chuan, and also 八段锦, different type of Qigong exercise. And that while most of the patient recover fairly well, the severe patient may take up to 1 year for full recovery. So it's not the Western concept of once the infection is over, once the body is free of the virus, you discharge the patient and that's it. Okay? The long-term recovery may take up to 1 year. And then lastly, during this 1 year time, to avoid infection if at all possible. Okay, so avoid crowded place, avoid somebody who may be coughing, wear a mask for extended period, because you don't want a patient that's recovered to then catch another influenza type of infection, because the lung is still fragile. You don't want it to turn worse. All right, so that's all. And once again, all the references are posted at the website at Lotus Institute. So you can go to it and rewatch any of these presentations. You can download any of the PowerPoint slides. And if you have any questions at all, feel free to send me an email or send Donna an email, and she will definitely forward it to me. All right? So thank you for your time and attention, and I'll see you next time.
When I was talking about the TCM resources. Can you see it right? Can you see my screen now? Yes, perfect. Okay, so I'm going to teach you guys how to go to the TCM resources from our eLotus page. So first you would go to eLotus.org and just double checking one more time. Can you see the website? Yes, perfect. Okay, so on our website, you go under you're automatically on continuing education. Go under free stuff, and here's the COVID-19 resources link, and you click on that. And here on this page is where you can find Dr. Chen's past webinars that he's done with us. So this is the first one right here, and here's the second, third, and the fourth one, which is today. So you can access the recording for today's class by going to this link. And here you'll also find COVID-19 formula charts, articles that are also in different languages, and interviews, official recommendation handbooks, and other resources as well. So to get to the lecture notes, some people asked about that. I'm going to go ahead and click right here and click access course here. And you'll see the two videos that Dr. Chen recommend of Kadipan, and then the lecture notes. You can click that to download the lecture notes, and you can access the lecture notes later as well as the recording for today's webinar. It will be posted on this site later tomorrow. And if you want more information about herbs, some people asked how they can learn more about herbs. Dr. Chen did do a introduction class for herbs, and let me go back to his page here. So on his bio page, you can select TCM Wisdom Tube. These are past 1 hour webinars that he's done with us. And it's going to be Introduction to Chinese Herbal Medicine. So if you want a refresher on herbs, or you are brand new to it and you want to learn about it, you can find it here. And there are many videos of it. There's different categories of the herbs that he will be going over. So there's 12 in total. And finally, the books. You can look for sample pages on the Art of Medicine website. It's aompress.com. And there's this single herbs book, the formulas book, and the Chinese veterinary book. And this is by Dr. Sine Beebe, Michael Slutsky, Dr. John Chen, and Tina Chen. So go into the single herbs book, the Chinese Medical Herbology and Pharmacology, where you can find sample monographs. And here in Gantao, it tells you the Chinese therapeutic actions, and also information that is unique to Dr. Chen's herb books, such as chemical composition, pharmacological effects. There's case studies and research, herb-drug interaction, and toxicology. As you can see, the information on this one herb is quite extensive here. And then to buy your copy of the book, go to evherbs.com. And in the search box, you can type in John Chen, and his books will populate, and you can buy it here. And that's it. So if you guys have any questions, someone asked how to contact me. My email address is info@elotus.org. That's info@elotus.org. Okay, thank you guys so much for joining us today. This webinar has been recorded, and it will be posted up on our TCM Wisdom Tube as well as our YouTube tomorrow. Have a great day, and we'll see you at our next webinar. Bye.